The stabbing is so bad that it sometimes makes you really scream at that very moment. The burning is something that stays on.
For 11 years, Rachel Weiss has been suffering from shingles, a painful condition that is caused by the varicella zoster virus.
Shingles is a painful condition manifested with blisters that affects nerves of the body.
Dr. Angela Malis is the director of the Comprehensive Pain Program at the Toronto Western Hospital.
People at risk are mostly people who are older because our immune system gets weaker with age. 92% of cases of shingles occur in people of advancing age and 8% in people with immune system compromised because of disease or cancer or other treatments.
It was a pain starting from the middle of my waist going to my back.
50% of shingles will attack the nerves of the thorax around the trunk. And in 70 to 80% of the cases, pain will be the first symptom.
I had no outward signs of it except I had a backache.
When we get shingles, if we take antiviral therapy in the first 72 hours, we may be able to reduce the severity of shingles and also the prevalence of postherpetic neuralgia after an acute infection.
By the time I came back, because I had the rash, it was more than 3 days.
Unfortunately, some people are misdiagnosed and they think they have back pain.
Once the rash started, it was really burning. It was very bad, and it was really in both places, in the front and in the back also. And then came some stabbing pain. It's really, the stab is so bad that I almost jumped each time.
In the acute phase of shingles, a painful rash will limit the people in what they can do, or even if they sleep, it limits their ability to eat because they don't have appetite. But it's not just that. The acute phase of shingles may have complications if they affect your eye or if they affect your lungs, and you may have pneumonia, you may need to be in the hospital. So there are some very serious effects from shingles beyond pain and rash.
The worst part that shingle caused me was to force me to retire, which was very distressing to me. And I basically, the first year, I wasn't able to function at all.
One of the most lasting complications of shingles is postherpetic neuralgia. This is a very painful syndrome after damage to the nerves, and it can last forever. People with severe postherpetic neuralgia may have to take medications for life, and often they don't work well, so they get impaired in the ability to sleep, to eat, to move around, or enjoy life.
It's been 11 years that I've been suffering with that pain, and it has never stopped. It sometimes went down to a lower level, and it allows me to function, but it's never gone away.
In Canada, there are about 130,000 cases of shingles every year, and 18% of those will develop the later complication of shingles, postherpetic neuralgia.
There is an approved vaccine for shingles.
Studies have shown that in people over 60, the vaccine prevents 51% of cases of shingles and 2/3 of cases of postherpetic neuralgia.
Shingles changed my whole life. I became a totally different person. I became very intolerant about things going on around me because I was always concentrated on the pain.
It is very important for individuals to avoid shingles. We live longer now and we want to live well. So getting vaccinated, particularly in over 60 years of age, provides us with productive and good quality life, and of course saves the medical system, healthcare services and utilization.
Dr. Malis chairs Action Ontario, a not-for-profit organization that educates and advocates on behalf of patients with neuropathic pain.
Patients can find information in our website. They can link with our own group, and they can make sure they express their views and opinions so that policymakers and administrators can listen to them.
For more information about preventing shingles or managing neuropathic pain, speak to your doctor and visit actionontario.ca.